Professor Ravindran, could you maybe share your views?
Thank you. Thanks to the previous speaker who has highlighted the why of what are we doing health policy and systems research for, in order to achieve what. And so that health systems are more responsive to the needs of the most vulnerable, so that they uphold equity and social justice as values, and guarantee the right to health of all persons. So if that is the ultimate purpose of gathering evidence, one of the questions raised by the chair was, what do we call health systems and policy research? And there have been many examples given already, and I'd like to add one more to that, especially in the light of what we agree would be the very purpose of health systems and policy research. And that is research that not only provides evidence on what's wrong, what are the gaps, and therefore push you towards what needs to be done, but understanding of what are the factors or what are the causes why people behave the way they do, both healthcare providers and users of the healthcare system. Because therein lies the answer of both improving the quality of care, improving the intake of certain services, and so on. And I think we need to go beyond just behavioral to more structural factors that influence the way people think, behave, what they believe are the norms that they have to adhere to. Especially, we talk equity on the one hand, but the social structures are entrenched with hierarchical norms. So how then do we get from here to there? So that is a big challenge, and on this we need understanding as well. I'll now come to the main question posed by the panel, and for the panel, which is how do we embed health policy and systems research within the healthcare system? So I looked up the definition of embed, and one of the definitions is that you implant an idea so that it becomes ingrained in a particular context. So this really means a culture of inquiry, a culture of asking questions, but before that, recognizing and admitting that yes, a problem exists, and not to whitewash it, then to say, what is this problem, why does it exist, and what can be done about it. So the mindset is something very important that needs to be put in place. So I think one of the fundamentals is signals to the people in the system that it is okay to identify problems. So a system of rewards and reprimands that doesn't penalize people who admit that they have made a mistake or who admit that they are not able to achieve what they are required to achieve, but are seriously concerned about it and are looking for solutions. So I would just say that for embedding, this is one of the fundamental prerequisites. I think there are already a number of actions already happening which could facilitate the embedding of health policy and systems research within the health system. I will give examples from my own personal experience. For example, a number of state governments have recognized the need for public health training and have been sending their program managers for public health training. My institution is one where a number of healthcare providers, decision makers, have been coming to both to do their masters in public health and diploma in public health. And they learn a range of research methods. And I'll give you one example of how they do put this into use when they are back in their positions again. An RCH officer from one of the districts in Kerala, who, a tribal-dominated district, who came with the notion that the maternal mortality ratio in that district was much higher than other districts, and he believed that it was because of a very high proportion of home deliveries. I mean, Kerala, 1% home deliveries, but nevertheless, most of it, he thought, was concentrated in his district, and that was the reason why. And when he did his master's dissertation, actually what he discovered was that a very, very small minority of deaths were happening among women who delivered at home. In fact, many of them were taking off from home thanks to the ushers and the success of their motivation. But there was a big gap in terms of emergency obstetric care. And the tertiary care center was really very far away, down the hill. And so people were dying, women were dying in transit. And there were other systemic reasons, including risk aversion by medical officers who felt unsupported in their own. So he's back as RCH officer in his place. He knows what the issues are, and he's also in a position to take some action about working to reassure the medical officers at his places, give them better support, and so on. So this kind of this is one way in which it is getting, and this is happening more and more. I think the National Institute of Epidemiology is doing a lot of training of health service people from the health services. There are many other IIPH institutions now that are training healthcare providers and managers. The other possibility seems to me that the creation of the state health systems resource centers again provides quite a unique opportunity for institutionalization. And my colleague did mention that they were not doing probably the kind of research that they needed to do, but a kind of tripartite collaboration between the implementers, the SHSRC people, and research institutions in that state could keep the motivation going for undertaking research, could actually promote research capacity within the system, and I think that would be quite something very doable. The third is that health systems and policy research happens at various levels, and one is the action research, which is really practical, operational research about why is this PHC getting such a large number of this particular group of people, or why is nobody coming here, or why is the performance bad here versus in some other place. And the state institutes of health and family welfare, which do a lot of training, could be encouraged and could be developed to promote that kind of hands-on research, including understanding the data that medical officers themselves collect. And I've often found among my students, what do you do with the data? We send it upwards. So they have often don't even look at that data, but just send it upwards for being collated at the district level. So problem identification, problem solution at the local level is again something that is very doable. And so with these few words, I'd like to